How can I stop picking at my acne? That's the question that we're going to talk about today. Welcome, I'm Dr. Arthur Kolsky, founder and medical director of Advanced Acne Institute. We're a dermatology practice focusing only on the treatment of acne. That's all we do. So we have certain insights and experiences, and we like to share those with acne sufferers who are navigating the path toward clear skin, and we hope you find this information helpful. But remember, this is not medical advice. This is only for educational value only. So one of the things that we see at Advanced Acne Institute quite often is the observation in some of our patients that they have a tendency to pick at the breakouts that as they occur. And this causes most of the damage on their skin because a lot of times the acne itself is not as bad as the picking, because when our patients begin to pick at every little blemish that occurs, they break the skin, and the skin needs to heal, and it leaves discoloration, and the healing takes a long time because they typically keep picking at the same areas, and it becomes a big problem. And so we're trying to help them with their acne, but they keep doing damage themselves by picking at their skin constantly. So how do you stop that? So it's a challenge. So there's no easy fix, but let me share some things that we've done that have proved useful. For example, one of the things is to come to terms with the fact that that's a problem. So many patients don't even realize that they're doing that, and they just start picking away, and it becomes a subconscious activity. They're not really cognizant of the fact that they're doing it. And it could be something that they're doing while they're doing something else. They might be reading, or they might be watching a video, or they might be working, and they don't even realize that their fingers are reaching for their skin to pick, because it's something that is a habit that they do, and they don't even realize that they're doing it. And others, they realize that they're doing it, but it's something that's an obsession. They can't really break that obsession, and it becomes something that they just feel the need to do. And they sit in front of a mirror, and they look at every little potential blemish, and some of them try to actually find a spot that's starting to break out, and they want to remove it just before it breaks out. And so in their thinking, if they can pick it out, if they can pick it off, then it won't ever turn into an actual pimple. But actually what's happening is the picking itself is causing more damage than the pimple would have caused. And this becomes a very repetitive behavior. Now, coming to terms with the fact that this is a problem is the first major step, because then we can start taking action and taking steps to try to limit the damage that's done. So one thing is we can begin to modify the behavior. So when somebody comes to the realization that they're picking, they can start to stop that in their tracks. Not everyone can do that, but some patients are still able to realize that they're about to pick at their face, and they can pull back and stop and think about something else. Other patients use different devices that are made, like fidget devices, that help them channel that energy and channel that activity in another direction. Instead of damaging their skin, they use certain devices to help push that energy out to a different direction. Now, sometimes it's more easily fixed than other times. So for example, in some instances, when a patient will actually sit in front of a mirror and start picking away at any type of blemish that they find, one trick that we found successful for some of our patients is they put a note. They put a big warning note in the mirror that says, "Do not pick." And that actually, believe it or not, has proved very useful for some of our patients. And it's actually turned all of their picking around. And once they started doing that, the next visit, their skin was much more clear, and it was a huge difference. So that's another factor that can be very helpful. Another trick that you can use to try and prevent the tendency to pick. Now, sometimes it's more of a difficult problem, and the obsession of continual picking and the need to satisfy the need to pick away at the blemishes sometimes needs intervention beyond behavioral intervention. And sometimes medication is necessary. And a visit with a therapist to come to terms with this is the first step. But if that doesn't work, then perhaps visiting with a medical doctor who specializes in that type of problem can be very helpful, and prescriptions can be used sometimes to help break that cycle, that obsessive cycle of picking. But sometimes just going to a therapist and coming to terms and starting to realize that a person has the ability in some instances to intervene on their own and just modify their behavior and deflect that activity in a different direction, sometimes that's enough. But when it's not, then visiting with a medical doctor to actually discuss the possibility of a prescription therapy, a prescription intervention, can also be very helpful. So there are a lot of different ways of addressing this problem. And sometimes it's easier than other times because it's a very obsessive tendency to pick. But it is very important to try to come to terms with that behavior so that we can begin to gain ground, and that'll help us to finally come to a better solution for your acne, because sometimes the picking so overshadows the underlying acne problem that we can't even begin to address the acne problem until we stop the picking and see what's really underlying that and see what degree of acne is present. But we do try to stop the acne as a way to intervene in the beginning to prevent the idea that there even needs to be picking, because if there are no blemishes, then a lot of times some patients can do away with the tendency to pick because they don't really have any source to trigger the need to go to town and start working on the blemishes and picking at their skin. So it's important to talk with your provider and come to terms with this problem and explore the different options that there are to try and break that cycle. And so only then can we ultimately lead to clear skin and do away with the damage that's being done and the potential scarring that's occurring by repeatedly picking away at your skin.